the U.S. Surgeon General is warning of a dangerous health risk that as many as half of Americans are affected by at any given moment. It's not a new virus, bacteria, or any other kind of infectious disease. It's what he's calling the epidemic of loneliness. And in a new report, Surgeon General Vivek Murthy warns that levels of social isolation are growing in this country, with Americans now spending close to an hour a day or more by themselves than they did back in 2003, and 20 minutes fewer socializing with other people. And if we fail to address the crisis, Dr. Murthy writes, we will pay an ever-increasing price in the form of our individual and collective health and well-being. He goes on to say, instead of coming together to take on the great challenges before us, we will further retreat to our corners, angry, sick, and alone. To discuss, I'm joined by Jill Seti, a psychologist who now writes for Greater Good magazine, and Dr. Eugene Beresin, a professor of psychiatry at Harvard Medical School and the executive director of the Clay Center for Young Healthy Minds. Dr. Seti, Dr. Beresin, thank you so much for joining us.
Thanks for having me.
This is an interesting conversation, I think, because when we think about the things that we need in order to have good health, we're not necessarily thinking about mental health or what fulfilling social connection does for our mental health. And so, Dr. Seti, I want to start with you. It's a feeling officials say is difficult to quantify loneliness, and I think that's partly because it's a difficult thing to identify if you don't have language or introspection for it. So for the benefit of folks watching at home, how do you define loneliness?
Well, loneliness isn't the same as being alone necessarily. It's actually a disconnect between what kinds of social connection you want in your life and what you actually have. So that could mean not having as many connections, but it can also mean just not having sufficient connection with other people so that you feel supported, safe, and as if you belong in a community.
And Dr. Beresin, it has implications for our physical health too. What are some of the ways that we see loneliness manifest in our bodies?
Well, in adults, it has about a 30% increase in heart disease, about a 30% increase in stroke, about a 60% increase in premature death. And in younger people, it can cause inflammation and the problems with the immune system. Those are the medical aspects of loneliness, and there's certainly psychiatric or mental health challenges as well.
Do you want to say some more about those?
Sure. I mean, a loneliness can cause sufficient, especially in young people, and it so happens that the largest segment of the population that is lonely are the millennials and Gen Zs, and Gen Z is actually the largest. And one would not expect that because it has typically been the elderly. But there were reports by Cigna and by the BBC back in 2019, 18, and 1920, and 2020 that showed that the Gen Zs had the largest proportion of loneliness. And it was related to a trend that the Surgeon General reported about a crisis in youth mental health back in 2021 that showed that anxiety, depression, and suicidal behavior were escalating at alarming rates.
Ms. Seti, I'll go back to you. It's a private pain that we're bringing into public view with this discussion of this report from the Surgeon General, but it's not the easiest thing to come out and say to others, hey, I'm looking for some more meaningful connection. It makes you vulnerable. People get afraid that they might look needy. I wonder how you might encourage folks once they recognize that they're struggling with loneliness. How do you advise that they start fixing it?
Well, despite the fact that it may feel really vulnerable to admit that you're lonely, I mean, as you just heard from Jean, a lot of people are experiencing it. So you aren't alone in being lonely. And, it's even become worse because of the pandemic and how much we had to isolate from other people. So, one way to think about it is that way, is just to have a little bit of compassion for yourself. It's pretty normal experience for people. And of course, it's okay to be lonely occasionally, but what you don't really want to do is make it a chronic thing. So reaching out to friends and family. I mean, one thing that might help is that if you look at the research, people often appreciate it more than you think they will. They actually like to be reached out to. So, you know, contacting with people who are already close to you in some way, family or friends, can help. But you can also just go out in public settings where you might run into other people and have smaller interactions that maybe aren't so consequential, but they will also help with loneliness, because it's not just about the very close relationships. It's just feeling part of a greater whole or community that can help stave off loneliness. And of course, vulnerability. Oh, I was just going to say, and of course, vulnerability also often is a glue in social relationships. So even though you think, oh, I'll look needy, it's actually a way of making people feel like you trust them and care about them enough to be vulnerable with them.
And you wrote a piece for your publication that identifies some other suggestions that people should take up when they're feeling lonely. Were you inspired to write that piece because you found yourself suffering?
That's a good question. But, you know, honestly, I don't suffer a lot from chronic loneliness. I'm very fortunate that way, but I've been steeped in this research for 17 years now. I've been, you know, writing about social connection and the things you can do to increase social connection. And I also had an opportunity to interview Vivek Murthy a few years ago. So some of it came from stuff I'd researched in the past, and some of it came from my more recent work, talking with him and looking at the research. But yeah, there were several things. Certainly I use these strategies myself when I am feeling a little bit lonely. So not to say I'm never lonely.
I want to play a clip for both of you of one young lady who declared her private pain in a way that resonated with thousands of people. Take a look.
This is probably the loneliest I've ever felt in my life. I just want, like, a girl gang. I just want, like, a group of girls to be friends with. I don't know. There's just something so lonely about your mid-20s. I have people in my life. I do. But I don't know. It's just like a lot of weekends by myself, which is fine. I just don't like anyone. I don't trust anyone.
Dr. Beresin, Ms. Sethi, once I got past my own emotions in watching that, I thought about the fact that the Surgeon General, like you mentioned in his advisory, indicated that loneliness is most pronounced among teenagers and young adults. Yes. I think it was ages 15 to 24, who apparently have less contact with their friends, but use a lot of social media to find community. So I'm curious, for both of you, with respect to social media, are you looking at it as a tool for further connection, like to alleviate loneliness? Are you seeing it as something that ultimately gets in the way of more deep and meaningful connections?
The sword cuts both ways. I think during the pandemic, social media was fundamentally important. Many of my patients and the young teenagers and young adults used digital media to connect with each other. And despite the fact that it can be used for harm, cyberbullying, 1 in 3, the images that we've had on Instagram that have kind of made people feel terrible about, especially young women, about their bodies. So social media can be used for better or for worse. It's interesting. In the BBC study where they examined younger people, teenagers and young adults, so everybody kind of assumed that social media was the culprit. They found that the folks who were lonely versus those who were not reporting loneliness used just as much social media. So I think we've got to see social media as a possible ally. It can be extraordinarily valuable, for example, for shy, anxious kids, for kids who are on the autistic spectrum, high-functioning ones that really need to connect around certain activities. Groups can be meeting socially. And during the pandemic, it was a godsend. Now, that being said, I think we're all digital hostages, and there's excessive use and misuse of social media. And the fear of missing out and staying up way too late and getting sleep deprivation and having blue screens at night certainly don't help. So I think my advice to younger people and to their parents and grandparents is that we all need to kind of be more media literate and understand the uses and misuses of the apps that are on our phones and the amount of time we're spending there. And you can't beat face-to-face time. So in most cases, put the phone down and just have conversations is the best advice.
Jill Suttie, are you also viewing social media as a potential ally to help with this crisis?
Yes, I couldn't have said it better. That's exactly what I would say, is that social media cuts both ways. It can be an asset, especially for teens or young people or anyone really who's in a group that they don't feel they live in a community that's supportive of them, maybe for their political beliefs, sexual orientation, or whatever. It could, social media can be a way of feeling like you have a community outside of where you live that you can connect with, who can understand you and offer support, and that sense of belonging that's so important. So yeah, it can be really helpful, but that said, there are the dangers of bullying and social comparison, thinking everybody else looks like they're so happy online. They look like they're having the time of their lives. What's wrong with me? And you might turn it on yourself and assume that there's something wrong with you instead of recognizing that, social media isn't about necessarily opening up and being vulnerable. That's why it's important, if you can, to have, in-person contact and more places where you can be yourself. So also, of course, during the pandemic, it's all we had in a lot of cases. So it was better than nothing. But now that we're able to get out again, it's really great to be able to see people in person. I'm sure I'm not alone in having that feeling of relief of being able to walk the streets and run into neighbors and talk to people in shops and see my friends in person and give them a hug. Because, of course, physical touch is also so great for feeling connected to other people. And we couldn't do that much during the pandemic. So
it's certainly been wonderful being out of quarantine. Very quickly, from one or both of you, at what point would you recommend someone reach out to a professional for help sorting through their loneliness?
Well, I can begin. If the loneliness is coupled in particular with either anxiety or depression or suicidal ideation, if one feels so miserable that they can't function daily, I mean, the CDC's data on adolescent anxiety, depression, and suicide, which has skyrocketed since between 2011 and 2021, and the Surgeon General's previous report was on the crisis of youth mental health. Those kids that can't function normally, that have trouble getting to school, that can't think clearly, who actually become clinically depressed or anxious, really should get a psychological or psychiatric evaluation, as well as their family, because there's lots of things that are going on in the lives of kids and young adults. And I think that getting some professional opinion is extremely helpful.
All right, we'll have to leave it there. We're out of time.
Oh.
Dr. Beresin, Jill Suttie, do you have something that you really, really, really need to add quickly?
Well, I just wrote about a study about depression and anxiety where they asked one group to practice random acts of kindness to anybody in their lives, strangers, friends, anything, a couple of days a week for 5 weeks. And it had as much effect on depressive and anxious symptoms as doing cognitive behavioral therapy, which is kind of the standard of care. And it also increased social connection. That's what I wanted to get at, is that being kind, practicing acts of kindness towards others can take you out of that feeling of, focusing on your own loneliness and sometimes increase social connection. So,
an important reminder to be kind. Thank you so much.
There's one more thing. There's one more thing that I'd like to add, and that
Dr.
is
Beresin,
that
very quickly.
Yeah, our young people are overscheduled, and under the pressure cooker and not collaborative and not working collectively. And because in order to the pressures for academics and playing musical instruments and being on sport teams, they're working 24/7, and they don't have time actually to hang out. They don't have time because they're so pressured. So I think one of the things that Dr. Murthy and others have suggested is that we really need to look at how we're structuring the time in the United States in particular around overscheduling and overburdening our kids and derailing them and actually fostering loneliness, because they don't have, even if they had the desire, they wouldn't be able to do it because they'd be under the pressure cooker to achieve.
Another excellent point. We have to leave it there. Jill Seti, Dr. Beresin, thank you so much.
Thank you
you.
for having us.